Women are twice as likely to die in the year after their heart attack compared to the men of the same age. So I think these are very important issues that need to be looked at.
What if you had a heart attack and nobody seemed to notice? Well, for Canadian women, it happens just about every day. They're misdiagnosed by a system that is not well equipped to deal with them. And that's because for decades, almost all heart attack health studies were done on men only. Even now, about 2/3 of research on heart disease focuses on men, something that's left women in a very dangerous position. So, as Christine Birak explains, they say the system needs an overhaul.
Yeah, want another one?
Nancy Bradley has a family history of heart attacks. Just months ago, she drove herself to a local hospital in serious pain, told the nurse she might be having a heart attack. After waiting 5 hours, a doctor told her it was likely heartburn.
For the next 2 weeks, whenever it would flare up, I would get the pain in my chest again and discomfort in my arm and jaw. I would just eat Rolaids thinking it was heartburn.
Then, as Bradley was out walking her dog one morning, she fell to the ground with pain radiating from her chest.
And I knew that if I didn't get back home and call 911 that I was going to die.
Bradley was lucky. A new heart and stroke report says every 20 minutes, a woman in Canada dies of heart disease, and they don't get the same medical attention or care that men do.
Women in heart disease remains understudied, underdiagnosed and undertreated.
It starts with their initial symptoms. Women don't have what some call a Hollywood heart attack. They describe pain differently.
Women are more likely to have more sort of non-specific symptoms than a man, and that includes things like fatigue, shortness of breath, the sweats, palpitations, and that can confuse the picture where they may not recognize that this is actually a heart problem.
Researchers say menstrual cycles, pregnancy, hormones, and even their breasts make women more difficult to study. Most cardiovascular tests and drug trials for heart medications are tested on males, which may be why certain stress tests, scans, and drugs don't work well for women.
Actually ensure that the research is done in males and females, be that male and female mice or men and women in clinical trials. So these are key steps that I think we need to take.
Despite having had 2 damaging heart attacks, Bradley says the medical system is still ignoring her.
5 months later, I haven't seen a specialist for follow-up. Haven't been given any kind of cardiac rehab.
She hopes other women will hear her story and keep pushing for the attention and care they need. Christine Birak, CBC News, Toronto.
Canadian healthcare providers are changing their ways of thinking. There are 3 heart health centres in Canada that focus on women in Toronto, Vancouver, and Ottawa. And medical schools, too, including the University of Toronto's, are changing how they teach cardiac medicine, putting more emphasis on reducing gender bias in treatment.